Ladies and gentlemen, I have great pleasure in introducing Professor Kelvin Kong, who is a proud Warramai man, the first Aboriginal surgeon in Australia, an otolaryngologist, head and neck surgeon, and an amazing advocate in Australia. Kelvin is Professor of Otolaryngology, Head and Neck Surgery at the University of New South Wales, Newcastle, and Macquarie University. He has held leading appointments in many national and also other peer groups in Australia in our field, and with the Cancer Society and with the National Aboriginal Community Controlled Health Organisation. He has become what I consider the spokesman on everything from COVID through to census taking. So Kelvin, welcome. And I'd like to ask you a few questions. The first one is, what made you decide on a career in otorhinolaryngology, head and neck surgery?
I think we're really blessed in ENT, and I'm extremely lucky, and I pinch myself every day in how lucky it is. I guess sometimes I'm trying to give a very articulated, intelligent answer, but it really comes back down to passion and some of the experiences I've had. And there are probably two stories I'd like to share, which I've spoken to you briefly about before, but probably extrapolate a little bit on them and how it made me feel. And the first story is when I was quite young in early high school. Everyone used to come to my house for help. And that was because my mother was one of our first Aboriginal nurses in Australia. And as an Aboriginal person in the community, I don't think I understood what inequality was. And I don't think I understood why people actually came to help mum. Where I was very lucky is that my sisters and I used to fight over who would help her. So whether it would be removing sutures, just some general colds and flu advice, immunisations, travel advice, all those kind of simple things, they would all come to our house for help. And there was always a buzz of activity, because when we're talking about family, and I always smile when I say this, is that my family and my immediate family probably extend to around the 100+ mark. So there's always a buzz of activity, which is great for a kid growing up. But as you're getting older in high school, you start looking at your friends, and I had many non-Indigenous friends who didn't experience the same kind of upbringing that I did in the poverty, but also in the access to simple things like healthcare. And they would go see their doctor, or they'd go see their health practitioner or their local hospital. And I'd start asking them to a family, why don't you just go to the hospital or go to the doctor? And the same answers always are back in that, I don't feel safe, or I'm worried, or they're going to give us the wrong advice, or, you go to the hospital, you're never going to come out of the hospital, or, those kind of simple things. And I think a mature reflection, you realise and certainly experience what we lived was this exclusion of our healthcare services. Now, Australia, having one of the best healthcare systems in the world, is a blight to see that a segment of our society don't get that access to them. And I think for that reason, we always had that passion and spurn to try and give back in some capacity to make sure that we can help out, which led me to medicine. And I was very lucky to study medicine. But one of the stories out of medicine was when I finished medicine, I graduated and worked at one of our busy city hospitals in Sydney. And it's right next to Redfern, which is one of our high density Aboriginal populations. And I saw an elderly lady there, and I got really, really excited, because it may have been my first Aboriginal elder. And for those international people listening, our elders are very revered and very respected. So they mean the utmost, the world to us. And certainly with my mother and my grandmother pushing me to do medicine, I felt this is my opportunity to shine, to actually have a chat to her. And after a long conversation with her about her ailments and what was going on and why she was there, and examining her, she started crying. And it really hurt me that she was crying. It hurt me that she felt this way. And I thought, what have I done? My nan's not going to be happy with me. My mum's not going to be very happy with me. I've actually done a disservice to all this work I've done. And it wasn't until when she calmed down that she started saying to me why she was crying, why she was upset, and she apologised. And she never thought she'd live the day to be treated by an Aboriginal doctor. And what really touched my heart is that it wasn't about me. She didn't know me. And as egotistical and as self-perfecting you can be, it really was about her and her journey and what she'd endured in her lifetime as an Australian citizen. To feel that it's taken her to an elderly state to feel comfortable being treated in a health system which is meant to be treating everyone. And it really touched my heart. And I remember that story every time, because this is not about an individual. This is not about us. It's about how we actually change the system to care for all Australians, particularly our First Nations mob, and particularly my family and ancestors and people who've been unfairly treated in their upbringing and the way they're going. So I think those two things together really brought me to health. And ENT was just one of those beautiful things. And, I probably am very lucky by people that I've been touched by in the ENT sphere. Yourself in the work that you do just bring a smile to my face. When I first met you, and when you reached out to me proactively to say, Kelvin, I'm over it, I'm doing this stuff, I had the biggest smile. I can still remember talking about it when you did that. Peter Carter, Peter Carter was great. Paul Fager was great. There's so many wonderful names that I'm probably being injustice to not naming all the people that I've come across and doing that. But the support I've had at ENT and the fraternity that we have in Australia in the ENT world is second to none. And we have a very diverse group. We have a very inclusive group, and we have a very warm group. And I think that's really warmed me to being part of this. And I think that's really lucky in how we are.
That's wonderful, Kelvin. Now, could you outline your career highlights, and particularly with respect to the research that you've done that has led to this award?
It's funny, you know, I turn away from some of the scientific aspects of that, because my career highlights are things that have made my community proud. My highlight when I finished medicine was the joy, and we've all experienced this who graduate from university, get 2 invitations to come to graduation. I brought about 20 people down, and all the mob that came down, and the smiles on their faces coming to the university was just enormous. And that was a sense of pride, because what they were reflecting was that the achievement I had was their achievement as well, because of the support. Similarly, when you talk to communities, and we all do across Australia, and we mention an Aboriginal surge or things, and a lot of people don't realise or know have met me, but the pride it brings a community, the strength it brings a community is something that I'm just eternally proud of, which brings back to my immediate passion in that, and that is my children who go to school and are so proud of their Warramai culture, are so proud of their family history, and the strength they have and the learnings they have is changing the face of Australia forever. And that's one group of the whole nation. And I think that's really, really important for us. And so I think if I go back to the pride I have in my research and my work, is about bringing awareness about ear disease and learning and education, because this is all it's about. It's about educating our country, and it's about learning, and you can't do that without hearing. And I think the ear is just the most magnificent, beautiful structure that just brings so much emotion, joy, happiness, and lifestyle to us, that for us to ignore it is at our own peril. And so I think that's really important that the research work that I've certainly been lucky enough to be involved in somehow embraces what we're going to do to maximise the joy out of hearing, as well as the educational learning aspects of hearing.
Great, thank you. I think you've answered probably some of the questions I was going to ask as well already. But what do you regard as your greatest challenge, and how did you overcome it?
The hardest thing that we all have is time paucity, probably the funniest thing. The greatest challenge for us is actually the awareness campaign around ear disease, and the awareness campaign around what it is to get equality in health and access to health care. And I think the hardest thing in achieving that is that we always think about, and we're guilty in the medical profession, because we think about a disease or a procedure, and some of the KPIs or the outcomes of those are drawn onto one aspect of something we do, rather than how we're going to change a whole upbringing. So for children, for example, with grommets, grommets are one intervention to improve hearing, speech, language development. But the real gain I get and the excitement I get is going to communities where there's horrible ear disease and changing that community's ear disease outcomes and seeing these kids dance, do cartwheels, read books, talk, get educated, and then later in life get jobs. And some of these kids that I'm lucky enough to mentor in the high school environment are just so talented. And what's really nice about that in the positive aspect is that we have not done that individually. We have done that collectively by making sure education is paramount, by making sure ear disease is looked after. And that's a really exciting part of it, because we don't actually touch on them individually in many aspects, but it's about how we're going to change this whole wave of making sure that we change the direction of the way First Nations people are being dealt with.
Thank you. Now, what has motivated you to be the best? What would you like to be your clinical legacy?
I'm motivated by seeing the faces on the people we look after and the smiles it brings and the happiness it brings. There is so much trauma, so much intergenerational trauma, so much heartache, and so much poverty in this country, particularly amongst Aboriginal and Torres Strait Islander people, that it's very disheartening when we're always talking about the negativity of this. I think where we can change that narrative is changing the language in which we use to help, but also how we can actually change this to make this a positive aspect. So rather than talk about that negativity, is talk about these wonderful kids that are coming through high schools at the moment, what the future holds for us in 5-10 years' time. Why my children are so proud of their culture, when I was at similar age, I wasn't even allowed to talk about it because it was actually a disadvantage, or my parents would be worried about me talking about it. That whole change is just so exciting for us. And I think, if we can change that aspect of access to healthcare, if we can change that access to understanding that, and that if we think, no matter who you are in Australia, that every child has an equal opportunity, and as part of that every equal opportunity, that we as ENT surgeons need to really push hard for making sure that every ear is checked, every opportunity is made to make sure they're progressing well, and every child should be looked at on both sides.
Well, thank you so much. That's such an important message, and it's one that many of us push as well, that every ear, every time, every examination. Thanks very much, Kelvin.
An absolute pleasure.